Hi, my name is Jessica, and this is my subcutaneous skills video. First, I have gathered my supplies here. Before I begin, in my kit was a 29 gauge needle that was 1 ml. For sub-Q, I would be using a 25 to 27 gauge needle. So I can begin here. So first I would verify the provider's orders with the MAR. I then would do my 6 rights of medication administration, which is right patient, right drug, right dose, right route, right time, and right documentation. Okay, so the label reads 10,000 units per 10 mLs, and on hand is 1,000 units, and that is for one dose. And when I did the calculation, it comes out to 1 ml, so I'll be doing 1 ml of heparin. Okay, so once I've compared my mark to my medication, I'm going to get my supplies. I'm going to go to my patient's room. I would knock on my patient's door, shut my patient's door for privacy. I then would go in and introduce myself to my patient, and I would say, "Hi, my name is Jessica. I'm here and I will be your nurse for today. Can you tell me your name and date of birth?" So I would look at their wristband for their 2 identifiers and make sure that they matched. Once I got that, I would ask them if they had any allergies. Do you have any allergies to anything? No? Okay, great. So after the allergies are asked, I will then hand hygiene. I will then get my gloves. I will put my gloves on. And then I can begin here. So the first thing I am going to do is I am going to educate my patient. I'm going to tell them, so I have heparin for you today. Heparin is a blood thinner. It may sting or burn a little bit when giving the injection. That is completely normal. I also would let my patient know that heparin is an anticoagulant. It is used to be, thins the blood, so it prevents the blood from clotting, and it prevents DVTs. So some adverse reactions to heparin that you do not want to see is bleeding from anywhere in the urine or in stool, and also adverse effects, abdominal pain, severe abdominal pain. They are a immediate concern. You must let me know right away. Those are things that we do not want to occur. Some common side effects are easily bruising. So since the blood is thinned out, it can cause bruising. So if you bump something, you might see a bruise or a bigger bruise in a certain area. Also, if you cut yourself, it may take a longer time because it does thin the blood, and it is used to prevent clotting. It may slow down clots, so your bleeding time may last longer than normal. I then would ask my patient if they had any questions. If they had no questions, then I would be able to proceed. Okay, so first of all, I am going to get my alcohol swab here. I'm going to take that out. I'm going to clean my vial after popping the top. Mine has already been popped off due to practice. Alright, I would throw my alcohol swab into the trash. I then would get my syringe. While that is drying, I'm going to open my syringe here. And I am going to pull back 1 ml, because that's what the order is, 1 ml of heparin. Right, so I'm going to open the cap. I'm going to insert the needle. I'm going to inject the air. Going to flip it over. I'm going to slowly withdraw. I would push back up on the plunger if there was any air bubbles. Alright, I'm pulling back to 1 ml. Keeping my needle in my solution. Okay, if there was any air bubbles, I would flick them out, or I would push back up and then withdraw some more of the med out. I'm going to flip it back over. Alright, I then am going to pull this straight up and out. Okay, I'm going to move this out of the road so you guys can see. Then I'm going to recap by scooping. Oops. Not by doing that. This surface isn't very flat. Alright, I'd scoop it up like this. And then I would push down here on the cap. Alright, in the real world that wouldn't go flying because I'd be on the flat surface. I have my thing on my box here, so it was a little wobbly. Alright, so I will show you here. It's 1 ml. I don't know if that angle's any better. This phone's kind of terrible to pick up on stuff. Okay, so I'm going to lay that down. Okay, so subcutaneous injections can be in the upper arm, in the abdomen, across from the umbilicus, and also in the thigh. So for this injection, I'm going to get all the umbilicus on either side. So I'm going to pick the right side, which is going to be right here where my pad is. Okay, so for sub-Q, I would first inspect my area, make sure that there's no redness, no irritation. I would palpate the skin, make sure there's not any hard spots. I then would I would then pinch to make sure my needle is at least half the length, and it is. So I'm good to go there. And then I'm going to clean my area. So I'm going to clean from the inside out, going about 2 inches. Okay, I would throw that in the trash. And then I'm going to let that dry for a second before administering my injection. And again, I have heparin at 1 milliliter. Okay, so my area has dried. I can then withdraw my cap, and the safety needle came on because this is a safety tip here. Alright, so with sub-Q, I am going to pinch the area. Okay, I'm going to inject at a 45 to 90 degree angle. So I'm going to go about here. I'm going to do a dart motion. Alright, and I'm going to slowly inject the 1 ml of heparin. Still going. Okay, all my medicine is administered. I would wait a few more seconds before pulling my needle out. I'm going to get my gauze here. Alright, I waited long enough, so I'm going to put my gauze down and I pull my needle out. I'm going to put this in my sharps container. Alright, I would hold this here for a couple seconds. I would then check for bleeding. My patient isn't bleeding, so I don't need a band-aid. If my patient was bleeding, I would then be able to put the band-aid on. That way, you know, they're not just bleeding to open air. I then would make sure that my patient is in a low position. They have their call bell. They have all their things within their area. I'd ask them if they needed anything else from me. And if not, I then can remove my gloves. I would dispose of these in the trash. I would hand hygiene. I would go out of my patient's room and I would shut my patient's door for privacy, and then I would document that I gave them the 1 ml injection of heparin. That's the end.